Let people trickle in. All right, it looks like the waiting room is settled, so we can go ahead and get started. Hello, everyone, and welcome to today's Peer-to-Peer Solutions Center office hours, launching the new HIV/AIDS resource guide for urban Indian healthcare providers. We are so pleased that you could all join us today. We kindly ask that you place your name, organization, tribal affiliation, and title into the chat box. My name is Margot Bailowitz, and I'm a public health project assistant here at NCUI. And joining me from the NCUI team are Divya Nanduri, Technical Assistance Manager, Kayla Emmerich, Public Health Associate, Carmen Toft, Communications Manager, and Jessica Gilbertson, Communications Director. If you have any technical difficulty during today's session, please send a private message to one of our team members and they will be able to assist you. In addition, we welcome any feedback you would like to provide about our office hours experience in our survey, which will also be posted in our chat box. Next slide, please. And one more, please. All right. And before we begin, we would just like to bring your attention to a brief disclaimer that this event is made possible by the Minority HIV/AIDS Fund through the Indian Health Service. Next slide, please. So as shown on today's agenda, we will begin with a brief overview of the CHAHA-O, followed by a presentation of the new HIV/AIDS resource guide, then an open floor session to provide feedback and ask questions, and then closing of our session at 3 p.m. Eastern Time. Next slide, please. All right, for those of you that are unfamiliar with NCUI, here's a bit of background. So the National Council of Urban Indian Health, also known as NCUI, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives, or AIANs, living in urban areas. NCUI is the only national representative of the 41 Title V urban Indian organizations, or UIOs, under the Indian Health Service in the Indian Healthcare Improvement Act. NCUI strives to improve the health of over 70% of the American Indian and Alaska Native population that lives in urban areas, supported by quality, accessible healthcare centers. Next slide, please. And over the next few slides, I would just like to go over some housekeeping items to get us started, which include the following. So this session is being recorded for educational and quality improvement purposes. All mics have been muted unless otherwise directed. Please feel free to turn on your camera to allow for interaction and engagement. Questions can be asked during the session via chat or by coming off mute. Please feel free to ask questions throughout the session by raising your hand or placing it in the chat. Don't feel the need to wait until the end of the session. And then we have an evaluation link, which can be accessed by a QR code on the next two slides, I believe, Divya, and then as well as via the website link that's placed in the chat. Next slide, please. Okay, so the objectives for today's session include reviewing the new HIV/AIDS resource guide, discussing any changes suggested by UIO feedback, and identifying any additional resources that may be helpful to UIOs to include into the guide. Next slide, please. So, like our previous Peer-to-Peer Solution Center's office hours sessions here at NCUI, we wanted to begin today's event with an overview of the CHAHA-O. So the CHAHA-O is the Navajo word for shade, shadow, or sun shelter. It's the only remaining Puebloan vestige on a construction technique once commonly used in the building of pit houses. Unlike Pueblo ramadas, Navajo shade houses seldom have earth-covered roofs and use leafy branches for cover. They range in size and materials, based on materials in the area and based on family need. A CHAHA-O is rarely finished because it requires constant care. The CHAHA-O is a warm and inviting place to gather, to socialize, to listen, to laugh, and to cook. And similarly, we hope that this event today will be a welcoming space to come together for peer-to-peer sharing. Next slide, please. So we encourage you to take some time after the event to watch the video that is on the slide here for a deeper dive and further exploration into the Chaha'o. The video link is placed in the chat box. The Chaha'o Zoom background image will also be placed in the chat if you would like to join us in turning on your camera and displaying the Chaha'o as your virtual background. Next slide, please. So before we dive into the resource guide, we just wanted to take a moment to gauge everyone's knowledge and intended use of the guide at this point in time. Once the window pops up on your screen, please take a minute to submit your responses and we will discuss the results shortly. So, oh, perfect, there it is. Take a few minutes to submit your responses.
Everyone see the poll? No one is participating.
I can see it, yes.
Can someone from NCUI participate in the poll so I know it's working?
I'm seeing some responses come in.
Okay, good.
I am as well.
We'll just give it another minute or so there. All right, Carmen, I think if you want to go ahead and close the poll at this point, we can look at the results. Awesome. So, great. Thank you all for responding to the poll. Let's see, for our first question for facility type, looks like we have some at outreach and referral, but most at other types of facilities. I'm actually excited to see that nobody who participated in the poll has seen the guide yet, because we will be launching into it today. And so that's exciting that we'll get to see it for the first time. People aren't totally sure yet how they plan to use the guide, and I'm hoping you'll have a better idea after this session. And it looks like people have some varied interests in how they'd like to provide feedback. For those of you that selected other, please feel free to type in the chat an additional way that you'd like to provide feedback or any other ideas. And please, any thoughts in general based on the poll, feel free to place your thoughts in the chat throughout. Next slide, please. Perfect. So again, thank you all so much for responding to the poll. Now we're going to go ahead and dive into the resource guide itself. So for the rest of today's session, we will walk through this new online guide and provide a space to share live feedback and suggestions. So we're going to discuss the 5 W's of the guide. So firstly, what is it? Then who is it for? Where can it be found? When should it be used? And why was it made? Next slide, please. So to jump in, the guide is a 44-page online PDF that houses hundreds of clickable links to online HIV/AIDS resources. It is intended to be a comprehensive compilation of HIV resources relevant to American Indian and Alaska Native communities. So these resources include things like toolkits, scientific recommendations and guidelines, videos, social media campaigns, one-pagers, and much more. The resources were compiled from a variety of sources, prioritizing those from Native organizations as well as those with Native-focused content. However, some non-Native sources were included where links provide additional information or tools. Next slide, please. So next, I want to discuss how the guide can be used. So in order to provide as many resources as possible without being too overwhelming, we hope, we've organized the guide into several different categories. So first, we provide links for basic overview of HIV and AIDS themselves. Next, the guide is split into 3 major sections. So the first has topic-based resources, the second is audience-based resources, and the third has action-based resources. So we hope that this organization will provide easy access to the different types of resources included. So you could quickly search through the guide for a source on, say, HIV testing to give to one of your clinicians at your UIO, for example. So due to this setup, many of the links are included more than once, since there is significant overlap between the sections. Next slide, please. And this slide is just to show here that the beginning of the guide has an entire page dedicated to this overview. So when you open the document, you can take a look at this page and easily orient yourself to the guide itself. Next slide, please. So you can use the topic-based section to find resources for HIV prevention, testing, treatment, comorbidities. So that's, all things clinical. And then the topic-based section also includes some information on different demographic groups. So for youth, LGBTQ and Two-Spirit communities, and injection drug users. And so more specifically, within some of these categories, as the slide mentions, you can expect to find resources on PrEP, on condoms and safe sex, on syringe service programs, on gender-affirming care, Two-Spirit mental health, and much more. Next slide, please. And then you can use the audience-based section to find resources geared specifically toward both your providers and patients of your UIOs. So again, every resource in this guide is included to be useful for a general UIO audience, but we hope that this section will specifically help you identify resources that you can pass on to both patients and to clinicians. And then the UIO section itself, under the audience-based section, has some information about creating programming at your UIO, for example. So again, more specifically, you can find in this section information on how to take a sexual history, how to prescribe PrEP, how to work with AIAN patients. You can find online courses that could be helpful for your clinicians, information on indigenizing safe sex, information on helping to end the HIV stigma, prescription discounts to pass along to your patients, and more. Next slide, please. So then you can use the additional resources or action-based section to find information on funding opportunities, social media campaigns, upcoming events, location-based resources, contact information for NCUI as well as other organizations, and resource lists, similar to this guide itself, compiled by other organizations like IHS and CDC, for example. Next slide, please. And then a final contact section houses HIV/AIDS hotlines, service locators, organization homepages, and social media information, as well as all of NCUI's contact information and social media information. Next slide, please. Okay, and I just wanted to break here for a moment now that we've discussed the content of the guide itself to see if anybody has any questions at this point or anything to share. Kayla, was there anything in the chat so far?
No questions in the chat at the moment. I did just want to draw people's attention to the fact I did drop the link to the guide itself there. If you'd prefer to follow along, have those visuals and kind of explore as we're going, feel free to pull questions as you go, and we're happy to answer them at any time.
Awesome. Thank you so much, Kayla. All right, so if there are no questions at this time, then we can keep moving along. And again, please feel free to raise your hand as you're following along if anything comes up. But so now that we've discussed what types of information the guide contains, I want to touch on who it was made for. So again, this guide was designed to be a helpful resource specifically for UIOs. Now that includes UIO executives and staff, clinicians, your patients, your clients, and all other stakeholders. Information pertaining to providing HIV care to urban natives can be difficult to find, so we wanted to compile relevant information into a centralized location. We do want to note that some resources included are geared specifically to tribal nations or tribal clinics and IHS facilities, though we do believe that these resources still have applicable information to a UIO setting, even if they were not created specifically for UIOs. Next slide, please. So the next thing we wanted to cover is when should UIOs use this guide? So this slide lists a few examples of when it might be a helpful tool to turn to. So to stay up to date on current HIV/AIDS data and scientific guidelines, to find online courses and trainings that you could pass on to your clinicians about treating patients with HIV and working with AIAN populations. You can use it to find helpful resources to pass along to patients, for tips on developing HIV programming within your UIO, for clinician recommendations and trainings. There are some resources to find supply vendors for things like condoms or HIV and STI testing kits. There are lots of social media campaigns in the guide, both to take inspiration from, to create your own campaign, or to take part in as well and promote on your own social media accounts, and to learn about upcoming events, both from NCUI and external organizations. So those are just some examples, but ultimately we hope that you'll turn to the guide when in search of HIV/AIDS resources that are applicable to your UIO settings. Next slide, please. So next we want to talk about where to find the guide. So the link to the PDF, as Kayla mentioned, has been placed in the chat, so please feel free to take a look there and follow along as we go. But for future reference, the guide is also housed on the NCUI website. So when you're on the website, and this is depicted in the image on the slide here, you'll navigate to the menu, the top menu bar that's in sort of a dark green color, and you'll click the Technical Assistance tab. Then under the drop-down menu for technical assistance, you'll want to select Community of Learning, which is shown here on screen, circled in red. Then once you're on the Community of Learning page, which is shown here in the tan background with the 6 different boxes, you'll want to click on the HIV/AIDS resource tab. Next slide, please. So then once you're on the HIV/AIDS resources page, you'll see a bunch of recordings and slides from our past webinars. And then you'll want to scroll down all the way to the bottom section of the page, which is seen here on the slide, which is titled Additional Materials and Links for Other AIDS/HIV Grant Events. So in the bottom left, you'll click on the green Download Toolkit button under HIV/AIDS Resource Guide, which is indicated here with the red arrow on the slide. Next slide, please. Okay, so now that we've discussed what the guide is, who it was made for, when to use it, and where to find it, I want to take a moment to share why we decided to create the guide. So the HIV epidemic continues to affect millions of Americans every year. Of those affected, American Indians and Alaska Natives have the highest rate of undiagnosed cases compared to other racial and ethnic groups in the US. American Indian and Alaska Native health data is also consistently underestimated due to racial misclassification. So lack of access to testing also accounts for some of this disparity. According to the Urban Indian Health Institute, only 21% of urban natives have ever received UIO HIV testing services within their lifetime. Now, this prevalence of undetected cases leads to increased risk of HIV-related death among American Indians and Alaska Natives. Now, despite these disparities, we know that it can be difficult to find effective, high quality, and culturally appropriate American Indian and Alaska Native HIV/AIDS resources. So we hope that in order to alleviate some of this difficulty, we've created this resource toolkit. Again, the guide is meant to be a working document. So just as HIV best practices change with new research and information, so too will this guide. Again, our intention is for this to be a regularly updated living document based on your feedback. Next slide, please. Okay, so with that being said, now that we've taken a deep dive into the resource guide, we do want to take some time to hear from you all. So thank you so much for engaging with today's session. And now if you have any questions from the presentation or feedback to share with us, please feel free to raise your hand or to come off mute or type any questions in the chat. Next slide, please. So we have listed some questions on the slide here to get the conversation going, but please feel free to discuss anything that comes to mind, and the floor is now open. Kayla, anything in the chat at this point?
Nothing in the chat at the moment. I would just re-emphasize what Margot just mentioned. Feel free to come off of mute. Feel free to type in the chat. Any thoughts or comments as well as questions, everything is welcome. We want this to be an informational session to help you use this guide. So please help us help you.
I just wanted to say thank you for sharing, and we look forward to getting into some HIV screening and other prevention activities here, and so I think this is going to be very helpful. Thank you.
That's awesome. Yeah, great. Thank you so much for sharing. I hope this will be a good resource. I would definitely recommend taking a look at the UIOs section, specifically under the audience-based resources, to see if there's anything that's helpful there about building up programming. Thank you for sharing.
And that comment does actually dovetail into a question I've gotten before on these types of guides. They can be a little overwhelming to look at to start. We did prioritize getting a lot of different information in there. So Margot, I'm wondering if you can share just any good starting places or sort of step ones if people are looking at this guide for the first time.
Yes, Kayla, thank you for the question. Definitely an important question because, again, it can be a very overwhelming document with lots of information and resources. So my first piece of advice would be to go to that how to use this guide page at the beginning of the document that we showed previously. I think this will be helpful in sort of tailoring you to where you might want to look first, depending on your own needs. So if you have some specific question in mind or HIV/AIDS related need, that how-to page will sort of point you where to go within the guide. But on the other hand, if you are looking at the guide for the first time with not really any specific goal in mind, but are just sort of hoping to look through it, I think that this page will also help you in deciding where to go. And I think thinking about if you're looking for a resource for a specific type of audience versus to learn something specific for yourself would be helpful, because I think that will put you to either the audience-based section or the topic-based section, and then you can sort of narrow it down from there. Kayla, it looks like something came through the chat. Is that right?
Yes, we did just get a comment from Iona, I believe. I hope I'm pronouncing that correctly. And they're saying, I'm creating a course on structural and social determinants of health inequities, and we'll hopefully be able to include this in the resource section, which is fantastic. Thank you for sharing that. And would emphasize to everyone, please feel free to take this guide and use it, share it, reference it, make it public. We don't want to make anyone reinvent the wheel here. This is supposed to be spread and used by everyone here. So yes, please take it and use it in your work.
Yes, amazing. Thank you for sharing that. I appreciate that so much. I also want to say that if anybody has any initiatives they're working on or projects or anything that they think might be helpful to others to be included into the guide itself, please feel free to either drop that in the chat or share that with us later on, because we really want the guide to be sort of, in the theme of the office hours event of peer-to-peer solution sharing. We want that to carry over to the guide itself, so that different UIOs and different facilities can sort of have almost like a one-stop shop place to see other people's success stories with HIV/AIDS programming and learn from each other. So we definitely welcome providing us with any resources that you think would be helpful to additionally include.
Sorry, I'm eating, but I just wanted to ask, it's probably in there, but are you familiar with the Northwest Portland Tribal Health Board? I believe is their name and their ability to distribute test kits and things like that.
Yes, thank you so much for sharing. We definitely have their information in there, excuse me. They're one of the organizations where we have a page with other organizations' resource list compiled for your viewing. So they have great things in addition to the kits which you mentioned. They have so many resources there that can be found in a number of different sections within the guide. So for sure agree, and thank you for sharing.
And Margot, wanted to suggest if you'd like us to share the guide just visually, and we can kind of scroll through it together, just in case if folks want to get kind of a sense of the flow or ask us to jump around so they can see different things, this could be a good time for that.
I think that's a great idea. Divya, are you able to do that since you're sharing screen?
Yes, I'm about to pull that up right now.
Thank you so much. So in live time, you can see that's where it's housed on our website. Divya pulling up the guide here.
And while this is getting pulled up, we do have a comment in the chat as well. If this was already shared, disregard, but Southern Plains Tribal Health Board also has free HIV tests that can be sent out through a native test by texting text 55251. That's an excellent additional resource there.
Amazing. Yes, thank you so much. We will definitely make sure that gets included. Thank you for sharing. And then, yeah, it looks like Divya is scrolling through the guide here. So this is our cover page. We worked with our graphics design team at NCUI to make this the beautiful document that it has turned out to be. Okay, so we have our table of contents, which includes all clickable links here. So if you find something that's interesting or looks like it could be helpful to you, if you click on it, it will take you directly to that section of the guide. As Divya demonstrated, we went to the condoms and safe sex section of resources, which again, all of these links are clickable, so would then take you to the actual resource on the website where it comes from. And we have a bit of an introduction explaining sort of the why of the guide, as we went over a few minutes ago, about why we thought this was important to create. And again, here is the how to use this guide section that goes through a bit of a breakdown of where you might be able to find certain resources. So I would say definitely go to this page the first time you're opening up the guide, and it will orient you to the document itself. And then here's our sort of basic overview and data inclusion on sort of general HIV/AIDS facts, and as up-to-date data as there is before we get into our topic-based section. So again, this is just your sort of basic HIV/AIDS overview. Could be helpful both for patients or clinicians. Again, current data and statistics on HIV in Indian country. And then we get into that first topic-based section. So it includes some clinical information, as you can see here. We have a first section on prevention resources. And breaking that down even further, we have information about PrEP, for HIV prevention. Again, this is the condoms and safe sex page that we jumped to earlier. Syringe service programs. And then we move into HIV testing resources.
I believe this is the NPAB testing materials that Justin had mentioned earlier too. So.
Yes. Thank you, Divya. Then moving into HIV treatment with a very clinical focus. So this has like guidelines for physicians, information about different HIV medications. And then we have some information here about comorbidities. So things to keep in mind of other diagnoses that patients may have who also have HIV, or things that are important to keep in mind when treating patients who may have HIV. And then we move into the section again on high-risk groups. So we have information regarding youth. So that includes prevention for youth as well as treatment. And then our Two-Spirit and LGBTQ section. So there's information about mental health, gender-affirming care, exploring sexuality, data regarding HIV within this population, and more. And then our section for injection drug use, things about syringe service programs, how to clean your syringes. And again, since we're in the topic-based section, resources there could be helpful for patients or for clinicians or for UIOs themselves. It's not split out separately until we then get to our audience-based section. So here are all the resources that we think could be helpful to give to the providers who work at your UIOs for treating patients, online trainings that may be helpful, and more. Information about prescribing PrEP, working with American Indians and Alaska Natives as a clinician. Some online courses. There are a lot of Indian country echo courses that we've highlighted throughout the guide. And then again, our section for UIOs really focuses on like building up your HIV/AIDS programming within your UIO. Testing, how can you build up your harm reduction services, treatment and linkage to care, as well as information about wellness programming related to HIV/AIDS, and social media and outreach, examples and toolkits about developing your social media content. And then again, here's our section with resources that we think might be helpful to pass on to patients. So this includes all kinds of different topics. It includes a lot of like simple one-pagers that go over sort of an overview of, for example, PrEP, how to clean your syringes again, where to find testing, what to do if you are HIV positive and have COVID. So lots of different things here under the patients section.
And Margot, as we're going through this overview, just had a question that folks might be wondering about, considering that this guide is new for us and for everyone. How can organizations and individuals at these organizations stay informed and involved as we develop and implement this guide going forward?
Yes, for sure. Thank you for asking that, Kayla. So that's a great question, and I think it's something we're still figuring out as we go. And honestly, we would love all of your feedback about how you think it would be most helpful to be informed. But we're definitely hoping to update the guide regularly. We're thinking maybe on a quarterly basis or so. So I'm thinking within our NCUE newsletter as well as emails, we will send out the new version of the guide every time it's updated. So you can definitely keep up to date that way. You can always take a look on the website for the most up-to-date version. I also recommend, if you're interested in using the guide but not super sure where to start, to reach out to us directly. In a few minutes, we'll show how to find our technical assistance form on the NCUE website. So you're always welcome to submit a request for one-on-one technical assistance with us, and we can go over the guide and how to be involved, as well as any of your other needs relating to HIV/AIDS services or otherwise. So those are some ways to stay up to date with the guide. But again, this is new and a work in progress. So we're super interested in hearing what would be most beneficial for you all in terms of keeping it updated and staying informed. And let's see, as we continue to walk through the guide here, it looks like we're at our final section. So some of these sort of more action-based or other resources. So here's a nice list of some potential funding opportunities to look into. Again, this is something that will need to be updated pretty frequently as these change with time. And then this location resources section has sort of a variety of different types of things. Some are articles about success stories within specific cities or specific states, or data from certain specific locations. And it's all sort of indicated there about which locations are pertaining to each resource.
And I would say that is definitely an area where we could use continued input if you have local resources that aren't listed there. We did our best, Margot especially, to really find all of these particular organizations and resources that are very localized, but we don't know every community, we don't know every locality, so please feel free to share with us.
Absolutely. And then we have a section on social media campaigns. So these are things that you're able to pull from either to promote on your own social media or to gain inspiration for creating your own campaigns. They're from a variety of different organizations here, as well as like toolkits on and tips for creating your own HIV/AIDS related social media content. And then again, another section to be updated pretty frequently is our events section. So we have different awareness days and information related to HIV, as well as registration links for upcoming NCUI events and past resources from past events, so our slides and recordings from previous webinars. And then here's that section with organization resource lists. So other organizations external to NCUI that do a lot of work with HIV/AIDS, with Native communities, et cetera, that have their own resource lists of helpful HIV/AIDS sources are linked directly here for easy access. And then again, for the contacts, there are a list of lots of hotlines. Then we have service locators there at the bottom. And then contact information here. So again, homepage links for relevant organizations, social media handles for relevant organizations as well. And then all of NCUI's contact and social media information there. We have our technical assistance request form here, a link to our newsletter, and a contact form. So easy links for reaching us always. And then lastly, we have some citations for the information that's included within the guide. So that is a walkthrough overview of the guide itself. I'll pause again to see if anybody else has any additional questions at this point in time or anything else to share. Otherwise, we can go ahead and pull back up the slides.
And we do have another comment in the chat from Iona. Again, I'll know more once I'm able to go through the guide more thoroughly. And thank you for consolidating as much info and resources into one place.
Oh, yes, absolutely. Thank you for that comment. Totally understandable. It's a lot to go through. So we appreciate your feedback at any time. Always feel free to email us or again, put in that technical assistance request as you are looking through the guide and think of things. We are super excited for this to be sort of a collaborative living document with you all.
And I can go ahead and share the link to our TA request form in the chat, just so we have that. Want to really emphasize, we are here for you for this one-on-one technical assistance. We could take some time just to go through the guide. We're happy to help you identify trainings for you and your staff. We're happy to help you kind of brainstorm and take those first steps towards implementing a new HIV service. Anything that we can help you out with, that is what we are here for. And I will just go ahead and pull that link up.
Awesome. Thank you, Kayla. And then again, if anything else comes up, please feel free to drop it in the chat. But for now, I think we can move on to the next slide. Yeah, so thank you so much to all of our UIOs and participants and attendees today for participating in today's Peer-to-Peer Solutions Center, launching the new HIV/AIDS resource guide for urban Indian healthcare providers. Again, we truly appreciate your presence and all of your comments and insights and resources shared with us during today's session. Next slide, please. So we appreciate any feedback that you would like to provide about your session experience. Please complete our survey by using your phone to scan the QR code that's listed on the slide here, or by clicking the link that is placed in the chat box. And please remember that you'll have a chance to receive an exclusive NCUI swag package for filling out the survey. So thank you so much. Next slide, please. And again, as we mentioned, for one-on-one technical assistance, you can submit your requests at ncui.org/TA. And again, that has been posted in the chat. Next slide, please. So additionally, we would also love to hear from you on your STI programming or proposed support through our STI survey that is currently open. The link for this as well will be placed into the chat. But based on your input with the survey, you could receive up to $250 for your UIO for participating. Next slide, please. And NCUI is hosting many upcoming events that we would love for you all to join as well. So some specifically that we'd like to highlight are this week on the 28th, we'll be hosting Utilizing Culture in Grant Writing and Programming. On October 3rd through October 5th, NCUI is hosting a series of UIO focus groups for setting policy priorities for 2024. So more information can be found about that specifically on NCUI's website. But please, we would love for you to join whichever session is relevant to you, to hear feedback from you all to develop our priorities for 2024 policy-wise. On October 12th, we have Path to Vaccine Equity, Vaccine Toolkits, and Educational Materials. On October 17th, we're hosting Electronic Case Reporting Implementation, Results, Successes, and Challenges. So that's just a few of some of our many upcoming events. And we would love to see you all there. So please visit ncui.org/events, which is posted in the chat for more information and for registration links, as well as a comprehensive list of all events coming up soon. Next slide, please. And thank you all so much. Again, we really appreciate you all for coming today. We will stay on in case anybody has any further questions or feedback. But otherwise, that concludes our event today. We'll give you a bit